10 critical breast cancer symptoms you should never ignore. Did you know that breast cancer is the most common cancer among women in the United States? This alarming statistic means that, annually, about 30% of women diagnosed with cancer are confronting breast cancer. Research conducted by the International Agency for Research on Cancer forecasts a concerning trend. By 2040, the number of new breast cancer cases is expected to exceed 3 million annually, with deaths surpassing 1 million each year. Despite these concerning statistics, there's encouraging news. The early detection and appropriate treatment of breast cancer have significantly boosted recovery rates annually, thanks to ongoing scientific progress. With this in mind, in today's video, we'll detail the 10 breast cancer symptoms that should never be overlooked. Additionally, we'll explore effective prevention strategies and treatment options. Breast cancer develops when cells in the breast start to grow chaotically, leading to a disease characterized by various signs and symptoms. This complexity often means that in its early stages, the tumor may be exceedingly small, sometimes less than 1 centimeter, making it undetectable without imaging tests. Therefore, it's crucial for women to have regular gynecological checkups, at least annually, and to undergo routine screenings consistently. One of the earliest indicators to be vigilant about includes changes in the breast's appearance or texture, particularly the emergence of a lump. This lump, often firm and painless, is a primary sign of the disease, marking the tumor's onset, but it isn't the sole indicator of breast cancer. Let's dive deeper into the 10 warning signs to detect breast cancer that you should never ignore. And believe me, one of them will surprise you. 1. Presence of a hardened lump or nodule. Leading our list is the critical observation of a lump in the breast. This symptom, often painless, is the primary indicator of breast cancer, manifesting in approximately 90% of cases detected by patients themselves. It's important to note, however, that such lumps usually become palpable only in more advanced stages. Consequently, undergoing annual mammograms from the age of 40 becomes a crucial preventive strategy. 2. Discharge of fluids and secretion. An additional critical symptom to be aware of is nipple discharge. While nipple secretions can be normal, resulting from pregnancy, breast inflammation, or post-childbirth, it's the discharge without these conditions that demands attention. Typically, non-problematic discharge appears as a thin, cloudy, whitish, or almost transparent liquid. Notably, bloody discharge is uncommon and warrants immediate medical investigation, particularly if it emanates from only one breast without any applied pressure. Most importantly, breast cancer-related nipple discharge often presents unilaterally, occurring spontaneously, without the need for physical stimulation to be observed. 3. Redness, pain, and swelling. Monitoring the coloration of your breasts is crucial, as redness may signal an inflammatory process. It's equally important to be alert to breast pain that persists beyond your menstrual cycle. Swelling in a breast, particularly when it's localized to the area affected by the disease, is another critical sign. These symptoms, when observed, underscore the necessity of consulting with a healthcare professional for a thorough assessment. Early and effective medical evaluation can address any concerns and facilitate prompt treatment. 4. Nipple inversion. Now, let's examine nipple inversion, a noteworthy symptom to consider in the context of breast cancer. While not all cases of nipple inversion indicate a tumor, since individuals may be born with it or develop it during life events such as breastfeeding, it's vital to monitor this change, especially if it occurs suddenly or is accompanied by other symptoms like breast flattening or size alterations. Such changes could signal an underlying issue and warrant further investigation in conjunction with other symptoms. In cases of breast cancer, this symptom usually occurs when the tumor is located behind the areola, causing the retraction of the surrounding skin and, consequently, the inversion of the nipple. In some cases, this can even cause some discomfort in the area. 5. Changes in the coloration of the areola. let's turn our attention to a notable change that might be observed during self-examination: alterations in the areola's color. You might notice not just a change in color, but also the appearance of flaking and redness around the nipple. It's important to be aware that these symptoms can easily be mistaken for allergic reactions. Therefore, recognizing and not dismissing these changes during self-examinations is crucial. 6. Formation of sores and crusts. Among the more noticeable symptoms of breast cancer are ulcers, sores, or crusts on the skin, particularly around the nipple area. An additional sign to be mindful of is the potential retraction or hardening of the skin, which may present a texture that deviates from its natural state. 7. Orange peel texture. A notable change in the skin's texture, reminiscent of an orange peel, is a significant indication of breast cancer. This rough appearance results from the tumor altering the skin's texture as it infiltrates, leading to a noticeable thickening. Initially, these changes might be mistaken for irritation from clothing. However, if after a week the skin's irregularities persist and do not improve with topical treatments, it's advisable to seek medical evaluation. 8. Changes in shape and size of the breasts. While variations in breast shape and size are normal, often with one breast slightly differing from the other, significant asymmetry can be a cause for concern. The presence of nodules may lead to changes in volume, resulting in noticeable asymmetry and possibly a warm sensation in the affected area. These changes are typically driven by the tumor's impact on breast tissue, causing swelling or a reduction in size due to tissue retraction. Before we move on to the following symptoms, don't forget to give this video a thumbs up if you're enjoying the content. Subscribe to the channel and allow notifications to stay updated with our latest exclusive videos. 9. Itching. While often attributed to allergies and typically affecting both breasts, itching can also be a sign of a more serious condition. Specifically, it may indicate Paget's disease of the breast, a rare subtype of breast cancer which usually affects only one breast. The hallmark symptoms of Paget's disease include itching, flaking, and redness around the nipple area. Affected individuals may notice that the demarcation between the breast skin and nipple skin becomes less distinct, leading to alterations in the nipple's appearance. It may lose its rounded shape, resembling a wound instead. 10. Nodules and swelling in the armpits. Last, but certainly not least, we have one of the most significant symptoms of breast cancer: swelling and the presence of nodules in the armpits. Throughout different stages of life, it's possible for women to find lumps in the armpit area. While these lumps are often small and easily overlooked, they can also be significant in size and grow as the underlying issue progresses. In certain cases, the presence of nodules and swelling in the armpits is a significant indicator of breast cancer, suggesting that the disease may be spreading to the lymph nodes. It's important to recognize that the signs and symptoms of cancer can vary widely among patients. Some may not exhibit any of these signs, while others may experience multiple symptoms simultaneously. Risk factors for breast cancer. Understanding breast cancer extends beyond recognizing symptoms. It involves comprehending the various risk factors involved. These risk factors are typically categorized into 3 distinct groups, each contributing differently to the likelihood of developing the disease. Firstly, hormonal factors play a significant role in breast cancer risk. These include early onset of menstruation, late onset of menopause, and the use of birth control pills and hormonal treatments. Subsequently, lifestyle and environmental factors also contribute to breast cancer risk. Being overweight, engaging in minimal physical activity, consuming alcohol, exposure to radiation, and smoking are key elements in this category. Lastly, genetic and hereditary factors, which are derived from our genes and family history, account for approximately 5% to 10% of breast cancer cases. It's noteworthy that 30% to 50% of cancer cases are linked to avoidable external factors, so adopting a healthy lifestyle, including balanced nutrition, proper diet, physical activity, and maintaining body fat, can reduce the risk of breast cancer by up to 28% according to data provided by the International Agency for Research on Cancer. An important point to remember is that, contrary to some myths, breastfeeding offers a considerable preventive advantage against breast cancer, particularly for women during this phase of life. How to prevent and treat breast cancer. Exams to detect breast cancer are recommended for women starting at age 40 and for those with a family history of the disease. Some of these exams include mammography, ultrasound, magnetic resonance imaging, MRI, blood tests, and skin biopsies. It's vital to remember that breast cancer is highly treatable, particularly when diagnosed early. Treatment strategies are unique to each individual's case and broadly categorized into two types: local treatments, targeting the specific area of the cancer, and systemic treatments designed to address cancer cells throughout the body. Local treatment involves surgery to remove the tumor, radiation therapy to eliminate remaining cancer cells, and in some cases, breast reconstruction. Systemic treatment, on the other hand, includes therapies such as chemotherapy, hormone therapy, and biological therapy, which aim to combat cancer throughout the body. Sometimes hormone replacement therapy, HRT, may be recommended, but this should be done under careful medical supervision and for the strictly necessary time. Despite the worrying data, the incidence is relatively low before the age of 35, and not every lump is malignant. The majority found in the breast are actually benign. Furthermore, when breast cancer is diagnosed and treated in its early stages, the chances of cure can reach an impressive 95%. So, don't be afraid to touch your own body through self-examination at least once a month. Remember to schedule annual visits with your gynecologist or mastologist for professional evaluations. Breast cancer is curable, and early detection saves lives. We hope this video has been helpful in addressing such a complex topic. We would love to hear from you. Do you have comprehensive knowledge about the disease? Are you personally navigating through it? Or do you know someone who has had to deal with this diagnosis? Share with us in the comments. Let's find ways to support each other through knowledge, understanding, and empathy. If you want to stay informed about health and well-being, don't forget to subscribe to our channel, turn on notifications, and check out our recommended videos. We're committed to providing valuable insights to assist you in leading a healthier and more informed life. Thank you for watching. Bye.